Hello, everyone, and welcome to this presentation for Living Alone and Connected on managing the symptoms of Alzheimer's and dementia. I'm Michelle Seitzer, and I'm going to walk us through the slides. So here we go. Oh, and I'm going to go back to the beginning of the presentation and start from there. So managing memory changes. Common challenges, and of course, this is just data from the Alzheimer's Association, but every person is unique and everyone will have different symptoms and challenges. But overall, a lot of the problems with memory and thinking are short-term memory, keeping track of a purse or wallet, paying bills, planning and preparing meals, remembering appointments, or traveling out of the neighborhood. Ultimately, the changes to your brain affect the way you remember, think, and learn new information. And this, of course, affects all aspects of your daily life, because if you're struggling to remember something, you can't go on to the next step. If you're having a blockage in your thinking process, you can't move forward. So these are some of the common challenges and also signs of dementia. So even as I was preparing this presentation, I was thinking about signs and symptoms that you look for to determine if you have dementia or if you need to get checked out, versus the signs and symptoms of living with it and having that diagnosis. So, of course, it's the same on both sides. So whether you're having these problems and don't have the diagnosis yet, or you have the diagnosis, these are still some of the things that you may be struggling with. So we're hoping for some interaction here. So as you're watching this presentation, if you are willing to share, or if you have questions about specific symptoms that you're dealing with that you'd love to get some people thinking about with you and maybe generate some solutions for, these are some of the things we'd love to hear from group members about. What are the things that affect you every day? What are the things that affect you now and then? Because with a diagnosis like Alzheimer's or dementia, no 2 days are alike. And as a human, no 2 days are alike, right? But in terms of how you're experiencing the disease and the disorder, there may be some things that are a challenge every day, and then there may be other things that only happen now and then when you feel especially foggy, brain fog, or when you don't get enough sleep, you notice more challenges. So there can be a lot of variability in your symptoms and in the way you experience living with dementia. So we'd love to hear from you on what that looks like. What are the things that concern you if you're seeing certain symptoms progress, or things that maybe happened only now and then are now happening every day? What things have helped you manage these symptoms? We'd love to hear from group members about that, so we can share it and maybe help someone else who may be experiencing that as well. And then, when do you find a symptom becomes problematic to the point of calling your doctor or pulling in a professional? So we'd love to hear from the group on that. So here are 10 quick tips for symptom management. Because even though there are some different medications that may help with some of the symptoms, there's, at this point, still not a cure for Alzheimer's or dementia, and medications sometimes can only go so far. So here are some non-medication related ways to navigate life with these memory and thinking challenges. So first of all, talking about a new symptom or a symptom that's happening more frequently or a symptom that's concerning with your provider. hopefully you have a provider that you trust, a doctor, healthcare professional that you have a good rapport with, that you feel comfortable sharing your questions with, and concerns and symptoms, and they may have some insights for you that they wouldn't be able to share if they don't know that it's a problem or concern. So number one, reach out to your provider. Another helpful thing may be to record your symptoms in a journal, and you can do that in there's apps, there's voice memos. Sometimes you can text yourself. That's what I do if I'm out and about and don't have pen and paper and don't want to forget something I'm thinking about. I send myself a text message. But you can do this as a way to record your symptoms and sort of look for patterns in when it's happening, or where, or how you might be feeling when the symptoms are occurring. So keeping a journal of those things can be really valuable. Lightening the mental load. So this can look different for everybody, and it sort of depends on what's on your plate mentally, emotionally, etc. Whether you have a job or a family. But look for ways that you can take some of the stress off of your brain, because it's working hard. Our brains are working hard to process all the information that's coming at us. And if there are other things that are on your mind that can, impact how you are handling memory and thinking challenges. So if there's ways that you can lighten the load, and maybe that includes journaling about some of the things you're worried about. Maybe you write down the people that keep popping into your mind, or maybe when somebody pops into your head, you send them a text and say that you're thinking about them, and then you move on. And that could be a way of lightening the mental load. But find ways that you can sort of organize that information that's coming at you, and could be causing some further difficulties with memory and thinking. Make more margin in your schedule is another way to sort of offload the burden to your brain of trying to remember things. If you have more things to remember, it may be harder to bring those things to mind and recall them. So if you're involved in maybe 6 different volunteer programs, maybe you should only be involved in 2 or 3. And that might lighten your mental load and make more margin in your schedule. Ask for help if there's some chores or tasks that are really hard for you. For me, it's organizing paperwork. I like organizing and I'm good at it, but I need help getting started, or I need help to make the time to do it. If I had somebody holding me accountable to say, hey, you need to set aside 1 hour a week to organize your paperwork. That's a way that somebody could help me get that job done without having to sit next to me and do it with me, although that would be nice too. But find the things that are challenging in your day and see where somebody might be able to help you, whether it's to check in with you, or to sit side by side with you and help you with something that is challenging. Be kind to your brain. Don't something that I like to think about, and something that I struggle with, is the inner critic. Maybe you're familiar with that, but not telling yourself, oh, that was stupid, or you should have done better. Be kind to your brain. We're all managing a lot, but if you're managing a lot and managing a dementia diagnosis, that's a lot for your brain. So be kind to your brain, be kind to yourself, and don't beat yourself up for not being able to remember things the way you used to. There's a reason for that, and it is not your fault. So be kind to your brain. Use visual prompts and cues like Post-it notes. You could put maybe a little note next to the stove. Remember to turn off the stove before you walk away, for example, or a Post-it note by the door. I've done this for my husband sometimes. Do you have your wallet? Any places that you around the house where you might have to leave a room and forget about doing something before you leave. Give yourself a visual prompt to remember that thing that you need to do before you leave that space. And you can do that with audio prompts as well. There's apps, there's alarms on your phone. I have all kinds of alarms set on my phone to remember to leave by this time to get to this appointment. Remember to leave by this time to pick up my daughter from the bus, etc. So any ways that you can pull in visual prompts and audio prompts to sort of give you that push, give your brain that reminder, so that you don't have to put pressure on yourself to remember it. Let the tool do the work. Modify your living space and work environment. There's lots of ways you can do this too. I know for me, a cluttered space makes my brain feel cluttered. We don't always have the time we want to make a room super organized, of course, in our lives, but if you can clear even just a table, that is a place where you can feel more organized. Little changes like that in your living space and work environment can make a difference. If you're going to sit down at the end of the day next to a table that's stacked with bills and things that are pressing and weighing on you, you may feel that heaviness when you sit down. So find ways to maybe have a dedicated space for paperwork and organizing, and have that dedicated space be somewhere other than the place where you relax at the end of the day. And then, of course, there's vitamins and different herbal teas. This is not medical advice. I'm not a nutritionist, but there may be different things like fish oil or I think it's ginkgo biloba. I'm thinking of some of the ones over the years that I remember are supposed to be helpful with improving cognition and memory. So again, go back to number one, talk to your provider and ask them for their recommendations on things that might help the symptoms that you're experiencing. Of course, we'd love to know which ones you have done or you would try, what you would add to this list. And then these are some tips adapted from alzheimers.gov that could be used for yourself living alone, or if you have a caregiver coming in to help you from time to time, or if you would need a caregiver in the future. These are some different things that could be helpful. Keeping a routine, eating at the same time each day, writing down to-do lists, appointments, etc., in a notebook or calendar or in your phone, texting yourself. I make lists all the time, everywhere. I have multiple lists. And the physical act of writing sort of helps cement things in your brain a little more. Planning activities you enjoy and trying to do them at the same time each day. It's important to have those happy things, those happy places in your day and in your schedule. Consider using a system or reminders for taking medications, pill packs. There's different apps and tools that can help you be more consistent with taking your medication if it's an issue in terms of remembering if you took it, when you took it, etc. Loose fitting, comfortable, easy to use clothing. If, in the future, as the disease progresses, you are struggling with zippers and buttons and some of those fine motor skills, it might be helpful to have clothing that allows you to still have that independence in dressing, but doesn't require so much thinking and coordination, hand-eye, etc. Preventing falls is a big one, as balance may be impacted as the disease progresses. So using a sturdy shower chair or grab rails, and then serving your meals or having meals in a consistent, familiar place. and probably using the same dishes, that could help as well. So that's all I have, but I did choose a couple of my favorite top five, we'll say, Instagram accounts that offer dementia tips for caring for someone with dementia. But I think a lot of these could be adapted and applied if you're living alone with dementia. Um, these are five great accounts that have a lot of workarounds, strategies, words of encouragement too. So I hope you find these ideas helpful, and we'd love to hear what some of yours are as well.